I've got my mouth full. Mm. We are brought in on a personal safety consultancy basis to deliver training. My job title is just a security trainer or personal safety trainer. Yeah, so what it actually is control and restraint, but because it's 2020 now, we call it positive holding or safe holding. Yeah, or clinical holding because it's more fluffy. Oh, that sometimes patients will lash out at certain staff, and it might be because they've not really been explained what's about to happen. So one example is where staff were called up to help subdue a patient because he was lashing out. And whilst they were talking to him, and he calmed down completely and he got dementia, but whilst he calmed down, the nurse just come up to the side of him and tried to take his temperature by putting the thing in his ear without communicating with him at all. Just put it straight in, and he immediately lashed out again because he didn't expect it.
Yeah, pretty sure anyone would do that.
Yeah, know what I mean? Even if you was talking to someone and someone came around and put something in your ear. Wet Willy.
Oh,
Wet Willy, lucky you.
Oh, Wet Willy. I mean, idiots. I'm going to go make a cuppa.
Yeah, he was smashing the room up, and they weren't trained or allowed to restrain him. So to stop him from attacking any other patients or themselves, they just held the door shut and barricaded the door until he calmed down. It's weighing up outcome. If you let him out, what might happen? What's the worst case scenario? If you don't let him out, what's the worst case scenario and why? With me, they learn to balance the outcomes and the impacts of their decisions. Every situation or patient's different, and it's all good and well talking in a room about what you do in situations, but when it's heat of the moment with adrenaline, maybe a couple of your colleagues are off sick and stuff like that. There was one elderly lady where she thought all the staff in her room were burglars because she has dementia. And she thought they were all intruders, so she was breaking out of her own house where she'd been held kidnapped. So she was shuffling out, and we arrived to tell her that it wasn't the case, that she should go back to her bed, and she tried to hit us with her Zimmer frame. And then she goes, "All I want is for the lock on my door to be changed. That's how I know I'm safe in this house." And everyone was just trying to say, "Oh no, you're in hospital." Didn't work until one of the security guards said, "Hello, madam, I've come. I'm a locksmith. I've come to change your lock." And she says, "Yes, yeah, that's all I want." He goes, "You promise you'll go back in if I change it?" And she goes, "Yes." So he shuffles around with the lock, covers it and puts his radio over it and bangs on it and stuff. And then she went back in the room. I think it's a good idea. Animals and pets and stuff going into old people's homes, care homes, terminally ill. Imagine Gizmo in an old people's home. They'd be like, "Come, tickle wickle, leave me alone, tickle wickle." With all elderly patients, individuals, you have to be very gentle, hold rather than, and the force has to be proportionate to the individual. You can't even hold them in a way that if they resist might cause them pain. It's literally very gentle.
Squirrel paws.
Say that again?
Squirrel paws.
Squirrel paws? Is that what you were taught?
Squirrel paws. Squirrel paws. Your thumb has to be close to your hand because that's the bit that does the grabby bit. and it stops you from grabbing. So you only support someone through that action.
Oh.
Squirrel paws.
Squirrel paws.
Squirrel paws. Squirrel paws.
I'm going to go and take this.
How was it with COVID? If I'm honest, I mean, you can take out the swearing if you want, but it was fucking shit. And I know that everyone had their own battles to face and their own problems, and a lot of people had it 10 times worse. I get that, but it was shit. From my perspective, I wasn't told that I was going to be redeployed. There was no sort of game plan or anything. It was just sort of, woke up one day and was told that I would be going to a different team. There was no preparation. No, do you want to go? It was all compulsory or mandatory, or I can't remember what the word is, but, you know, I had to go. Oh, please don't put that in. Don't make me sound thick. Yeah, I wasn't told what I'd be doing. So I was sort of taking a guess. Luckily, they were an absolute beaut of a bunch. Really welcoming. And really, really nice. On PPE wise, I mean, it was an absolute joke. There wasn't enough. We didn't have the right stuff, and when we finally did get the right stuff, it was too late anyway. So with PPE, we were told to use it sparingly. And when we did have a positive patient, it would be up to our clinical judgment as to what to wear when we went into the house. But what we should have been wearing was the visors and the goggles and the face masks and the full gown, gloves, shoe protectors, and then seat protectors too, alongside the alcohol, gel and wipes. But when everyone went into crazy panic mode, there wasn't enough to go around, and we weren't seen as a priority for having the right PPE because apparently we didn't deal with COVID, but we did. Yeah, no, it was a joke. And all the instructions came from way above, so, but, you know, they weren't the ones going into the house, so they didn't give a fuck about what we were wearing because it wasn't them. I also went to work on a COVID ward, although I didn't have any patient contact. I was making the phone calls to the families to let them know how their night had been, if they'd died overnight. A lot of the patients had dementia and nurses with face masks. So, I mean, they couldn't identify who they were talking to anyway, which made them even more confused. They weren't allowed to wear uniforms, the staff on the ward, but there were fears of them wearing their home clothes and then taking it home and spreading it to their families. but they weren't allowed to wear them because apparently that would that would confuse them. So they were also having that risk. Unfortunately, when someone did die, they weren't allowed to do the normal things. Just show them compassion and dignity. And it was so sad. I can't even relate. I mean, that was my family member. And I ended up not seeing friends and family for nearly 10 weeks, to ensure I kept you all safe. And that was hard. Literally went insane. There were funny bits too. I mean, as nurses, we laugh at the most horrific things, but it's either laugh or cry. So we try and see the best in everything. I think that's. I mean, if you want anything, more juicy, or let me know. I'll have a think.